Today I'll be presenting a patient. Her name is Miss Wells, 28-year-old African-American woman with a history of asthma, which was diagnosed at the age of 2.5. She presents to the clinic with complaints of shortness of breath and wheezing following a near asthma attack that she had 2 days ago. She is currently in no acute distress and states her breathing is normal. She states she was at her cousin's house and exposed to cats, which triggered her asthma symptoms. At the time of the asthma attack onset, she notes that her wheezes were a 6 out of 10 in severity and shortness of breath was an 8 out of 10 in severity, lasting a total of 5 minutes. At the time, she used her albuterol inhaler and symptoms decreased but did not completely resolve. Since that incident, she notes she has had 10 episodes of wheezing and shortness of breath about every 4 hours. Her latest episode of shortness of breath was this morning before coming to the clinic. She notes that her current symptoms seem to be worsened by lying flat and movement and are accompanied by a non-productive cough. She also states she awakens at nighttime 2 times a night with shortness of breath. She's been hospitalized 5 times for asthma, with the last time being at age 16. She notes that she has never been intubated due to her asthma, but currently has no pulmonologist or allergist. She is not aware of any environmental exposures or irritants at her job or home and denies use of tobacco, alcohol, and illicit drugs. She previously mentioned smoking marijuana, but that was 5 to 6 years ago and no longer participates. She is currently not exercising, has no recent use of spirometry, does not use a peak flow, does not record attacks, and does not have a home nebulizer or vaporizer. She complains that the current symptoms are beginning to interfere with her daily activities and is concerned that her albuterol inhaler seems to be less effective than before. On physical exam, she is alert and oriented, maintains eye contact throughout the interview. Her chest expansion is symmetrical with normal fremitus. Bilaterally, chest is resonant to percussion with no dullness noted. Bilateral expiratory wheezes in posterior lobes with bilateral muffled words and notable expiratory wheezes in posterior lobes and no crackles heard audibly. Her in-office spirometry is as follows: FVC 3.91 liters, FEV1 to FVC ratio 80.56%, SpO2 97%. According to NAEPP, she would be classified under moderate to severe asthma, as her FEV1 FVC is greater than 80% but only marginally. She's experiencing symptoms throughout the day with multiple nighttime awakenings and complaining of some limitation to her daily activities, meaning her asthma is very poorly controlled. As a result, I would start her on a short course of oral systemic corticosteroids and reevaluate in 2 weeks with a follow-up appointment, and following that would begin her on a medium dose inhaled corticosteroid regimen to take daily while educating her that her albuterol inhaler is only effective if used during emergencies, but that the ICS daily will help keep her asthma symptoms reduced.